Welcome to the Dental Wellness Podcast by Dr. Joy Dental Clinic. We're here in Dubai Hills Mall today, sitting with Dr. Usama Azim, a UK-trained dentist, cosmetic and restorative whiz, and a former Scottish boxing champ. Dr. Usama, what made you trade in the boxing gloves for the dental drill, and do you recall your first ever patient?
First of all, thanks for having me on today. In response to your question, sport's always been something that I've always enjoyed doing, and it's been a passion of mine, keeping fit. And I was always told that boxing was one of those things that pushes you to your limits. Okay. And when that happens, it's a case of I wanted to make sure that I was as fit as I possibly could be, with me being quite the athletic individual. And in regards to that, I also wanted to help people though. So boxing kind of didn't work too well for me there. Yeah. So I traded the gloves in for the dental drill, and yeah, here I am today.
Good to have you.
Thank you.
And do you recall your first ever patient?
First ever patient, yes, I actually do.
Okay.
It was a scary one.
Tell us.
First one was a straight emergency. So one of the last things you expect to see coming through.
Similar to the boxing adrenaline, yeah. Probably the same vibe.
100%. I do remember a patient came in pain, and it was a case of how to get them out of pain. So you have to put on sort of your problem solving skills, and you have to figure out what the actual problem is to make sure that you're diagnosing things correctly and therefore producing the correct treatment at the end of it. So yeah, I do remember it was a very, very straightforward one. You know, the patient required a root canal treatment, so we did the first stage, and then we sent them on there. We got them out of pain to begin with. Yes. Ultimately, that is the priority.
Of course,
being
at that point, yeah.
So being a healthcare professional, it's always a case of making sure you're doing what's best for the patient.
At that.
So it's a case of making sure that they were out of pain. Once you got them out of pain, it was a case of we could carry on and they were at ease. So yeah, it was a stressful one, having it been my first one, but we got through it.
It set you up well for the future.
Yeah, absolutely.
Definitely. Okay, now we'll talk about bonding. So bonding is sometimes seen as a quick fix.
Yes.
But when do you say that a crown is the smarter choice? Mm-hmm. And have you ever had to push back when patients kind of want now quick fix? How do you manage that?
Yes, I think it's important, again, going back to the diagnostic element, and composite bonding is a fantastic form of treatment for most patients, believe it or not, but it doesn't suit everybody, and that's okay. A lot of patients want to have the quick fix, but it's not always in their best interest.
Okay.
One of the reasons why you might choose to go for something ceramic based like a crown is when the tooth is already quite heavily restored. So if there's a large filling inside the tooth and they want to cosmetically enhance it by you pasting something onto the side of the tooth just for cosmetic purposes, it's not necessarily doing the tooth any extra benefit, because realistically the tooth structure may be compromised underneath there, and therefore the tooth may benefit from something structurally more sound, and actually something that may last them a lot longer into the future as well.
Yeah, definitely. And how do you deal with patients who kind of push back on you and say, but I don't care, I just want this to look well, I don't mind about the health or the structure of my tooth. Yeah. I suppose as a dentist that's challenging, because really you understand the importance of the structural element of the teeth.
100%, and I think that's where educating the patient comes into its own, to be honest, and sitting down, spending the time to explain to them why something's better for them as opposed to what they actually want. Yes, of course, there's always cost elements and things like that have to be taken into consideration, but more often than not, when patients hear the reasons why something's better for them, they tend to take your word for it, and they tend to appreciate that more than anything.
Yeah, I suppose a lot of it comes from understanding. If the patient understands why A is better than B,
absolutely,
for that reason, it's easier for them then to make their informed decision.
Absolutely.